Chapter 32: HIV and AIDS related drugs. HIV is an RNA retrovirus, and it is unable to survive and replicate unless it is inside of the living human cell. Through its pathophysiology, HIV destroys CD4 T cells, and this destruction of the cells results in immune deficiency. This is why the CD4 cell count indicates the immune function for those with HIV. This is our priority lab to assess when we're wanting to look at the extent of the HIV infection. HIV symptoms begin to appear 2 to 12 weeks after exposure and can range everywhere from mild to severe, including things like fever, fatigue, headaches, myalgia, arthralgia, and night sweats. HIV is spread by contact with bodily fluids, everything from blood, semen, vaginal fluids, and even breast milk. This means the modes of transmission are usually sexual contact, drug, uh, direct blood contact, such as with drug abuse, or mother to child. The normal range of a CD4 count is between 500 and 1200 cells per millimeter. On the other hand, we could also be looking at other tests such as a plasma HIV RNA quantitative assay or an HIV resistance testing. When looking at stages, with the stage 1, this is the acute HIV infection. The viral load is high, and the persons in stage 1 typically exhibit flu like symptoms. For stage 2, the chronic HIV infection, the viral load is lower, but the virus is still being produced within the body. Persons in this stage may not exhibit symptoms of HIV, but can still transmit HIV to others. And finally, in stage 3, this is known as AIDS. This stage is the severest. People in this stage have very high viral load, and their immune systems are damaged. They're also very prone to opportunistic infections. When we start looking at treatment, we're usually looking at antiretroviral drugs, such as NRTIs, and these work to inhibit viral replication. NRTIs can be taken without regard to food, though didanosine specifically should be taken 30 minutes before or 2 hours after eating. Side effects include things like nausea, diarrhea, rash, abdominal pain, peripheral neuropathy, pancreatitis, and myopathies. In the case of NNRTIs, these bind directly to reverse transverse transcriptase enzymes, blocking that DNA polymerization. Side effects would include things like dizziness, sedation, loss of concentration, rash, nightmares, euphoria, hepatotoxicity, and Stephen Johnson syndrome. Protease inhibitors. These inhibit the protease activity, causing the formation and release of immature, defective, and non infectious virus particles. Side effects would include things like rash, nausea, vomiting and diarrhea, dyslipidemia, insulin resistance, hemolytic anemia, and again, that Stephen Johnson syndrome, those severe rashes. Fusion entry inhibitors. These prevent HIV entry into healthy cells by inhibiting the fusion of the virus to healthy cell membranes. Side effects would include things like rash, diarrhea, injection site reactions, anaphylaxis, fever, and hypotension. Chemokine coreceptor antagonists. These prevent viral replication by blocking the CCR5 coreceptor needed for HIV entry into immune cells. Side effects would be upper respiratory infection, cough, rash, dizziness, orthostatic hypotension, abdominal pain, and again, hepatotoxicity. Integrase strand transfer inhibitors. These limit the ability of a virus to replicate and infect new cells by interfering with integrase, the enzyme needed for HIV to multiply and divide. Side effects would again be nausea, diarrhea, rash. They'll also include things like insomnia, hepatic damage, and rhabdomyolysis. For the nurse's role, that's going to include a careful assessment of the patient's physiologic and psychosocial health needs, as well as patient teaching regarding managing the illness as well as not spreading the illness, assessing the patient's side effects and stressing the importance of drug regimen adherence. These patients are going to be on a lot of medications to manage this condition. And ways to promote adherence would be things like drug organizers, mobile device alarms, drug map with pictures, a drug diary, a support system, and patient education. Immune reconstitution inflammatory syndrome. This is related to a disease or pathogen specific inflammatory response. in the patients with antiretroviral therapy being initiated or changed. This is also going to be two distinct entities of this: a paradoxical, which is an exacerbation of treated opportunistic infections, or an unmasking, which is a response to undiagnosed or subclinical opportunistic infections. The risk factors is going to be things like a low CD4 count or a high baseline HIV RNA. Some common opportunistic infections would be things like tuberculosis, which usually affects the lungs, though may affect other organs. Kaposi sarcomas, these are dark blue lesions in the skin, mucous membranes, GI tract, lungs, and lymph nodes. And this is a condition that comes up a lot, especially in ATI and NCLEX as well. One thing to keep in mind, these Kaposi sarcomas, these lesions, are leaking fluid that is contaminated with HIV. Patients with Kaposi sarcoma are going to be on strict contact precautions when both treating the patient as well as even just cleaning up the bed and taking up their linens. Others would be conditions like toxoplasmosis. This is an encephalitis due to a protozoa found in uncooked meat and cat feces. Cryptosporidosis. This is an infection, usually in the bowel mucosa, due to a protozoa parasite. There could also be Mycobacterium avium complex, which is a blood infection due to bacteria related to tuberculosis. And finally, cytomegalovirus. This is an infection due to the virus infecting the entire body, especially as retinitis, leading to potential blindness. Again, we want to stress the importance of drug adherence for these patients. Also, assess their readiness to learn and discern their preferred method of instruction. Assess for the risk of non adherence, their coping, their decreased immunity. Again, we want to provide information on the necessity of adhering to this drug regimen. Provide opportunities for the patient to verbalize feelings, to ask questions. Encourage strategies to help cope with these serious drug side effects. These patients are on a very complex medical regimen, and we want to support them any way we can in adhering to that. Timing, especially in pregnancy, is going to be important. The timing of the initiation of treatment and the selection of regimens for pregnant patients may differ from those non pregnant. Keep in mind the dangers of transmission, and that HIV infected patients can transmit the virus during pregnancy, labor, delivery, and even breastfeeding. Post exposure prophylaxis. This regimen should be initiated within 72 hours in the event and continued for 4 weeks, anytime exposure is even suspected. Healthcare workers taking PEP have reported adverse reactions, most common reactions being nausea, malaise, and fatigue. For our first question, a patient asks the nurse what part of the body is most affected by the HIV virus. The nurse informs the patient that HIV primarily affects which system? That be A, cardiovascular, B, immune, C, renal, or D, hepatic? And that answer is going to be B, the immune system. For question two, when providing teaching, the patient being discharged home on antiretroviral therapy for HIV, which statement will the nurse include? That be A, do not eat raw fish, B, limit food intake to proteins only, C, avoid ingesting bananas, or D, applesauce may cause you to experience side effects of the medication. And that answer is going to be A, do not eat raw fish. For question three, the nurse identifies which condition is a common bacterial opportunistic infection seen in patients with HIV. That be A, cytomegalovirus, B, candidiasis, C, toxoplasmosis, or D, tuberculosis. And that answer is D, tuberculosis. And for our final question, a healthcare provider has been exposed to HIV while caring for a patient. Following the post exposure prophylaxis regimen, the healthcare provider will most likely receive treatment for how long? 1, 2, 3, or 4 weeks? And that answer is going to be D, 4 weeks. But anyway, that's all we got for this chapter. I'll see you in the next slides.